3 minutes late. Thank you all for coming. Appreciate this coming at the last minute. We put this press conference together in a little less than 4 hours, so that's kind of a record for us. My name is Kari Etram. I'm the Public Information Officer for Olmsted County Public Health. Graham Briggs, Director of Public Health, will provide a statement regarding the first confirmed case of COVID-19 in Olmsted County. We do have partners available that will also be able to answer questions after Mr. Briggs.
All right, thanks, Kari. For those that don't know me, my name is Graham Briggs. That's Grahambriggs. I'm the Director of Public Health for Olmsted County. As Kari mentioned, we need to announce that we've got our first presumptive case of COVID-19 in an Olmsted resident here in the Rochester area. We found out late last night that an individual was seen at Mayo and did seek testing there after developing symptoms. We did receive results late last night that this test came back positive through the Minnesota State Public Health Laboratory. That initiated an investigation in public health to determine what was going on with this case and if there was risk to the community. So what we did identify was that this person did have travel history to an area with known activity. We believe that's where this person was exposed. We're currently working with the Minnesota Department of Health to ensure that anyone that has been subsequently exposed is being monitored for symptoms. We believe that the number in the community at this point is small, but we are following up with some individuals here locally. Since we know or we are confident where this case was exposed, we don't see any evidence at this time of transmission locally. That doesn't mean that there's not transmission going on locally here, but this first case that we've identified, we feel pretty comfortable that they did not acquire the infection here in Rochester. So having said that about this first case that we have here in the community, we're not recommending any changes right now for our residents or businesses. We really want them to consider their unique situations, though, as they're making decisions about group meetings or whether they need to travel and that sort of thing for work or for personal reasons. We do want to remind the public, especially those that are at higher risk or that we've identified at higher risk as part of this, to stay away from crowds, avoid cruise ships, potentially air travel, and people at higher risk at this point really need to prepare to stay home if we make that recommendation at some point here in the near future. We have heard that there are increasing number of people seeking testing at our local medical facilities. As we see increasing activity around the United States, risk is growing for people that are traveling around around the country, and so we really want to encourage people to stay home if they're sick, but if they do need testing or need medical support, that we're working on building capacity in the community so that we can get people that need testing tested, as well as not to put too much burden or strain on our local emergency departments. We still need to be able to take care of people that get heart attacks or car accident victims and things like that still need medical treatment. So we want to make sure that we don't lead to a lot of people seeking testing at local emergency departments just because they may have been exposed. And so we're working on that currently. I think at this point, as we're seeing increasing activity around the United States, the chances of us identifying transmission in Olmsted County is increasing. We're likely to see transmission here at some point. And so I think part of the message that we want to send to people today is this is not a situation to panic. We are ready for this. We've been preparing for it actually for many years now as we've moved into pandemic preparedness and things like that in public health. So don't be surprised if we do mention that we see or have identified local transmission. And I think for the community and particularly for those at higher risk or for businesses, it's really time to consider now what you're going to do if we do start making recommendations around local transmission that might involve cancellation of travel or cancellation of meetings or moving the way that you do live your daily life a little bit here for the short term, really to avoid or lessen our chances for transmission here in the community as we start moving through, I think, rapidly developing situation here in Minnesota. I do want to say I think our community is well prepared for this. We've got the world's best hospital just on the street. We've got an amazing public health system here in Minnesota. I'm surrounded by an amazing group of people that are working very hard right now on this. And so I think I want the community to know in this situation that we are ready, we're preparing, and as we do see additional cases, I think we're ready to respond to this. And I think with that, I could take questions for a few minutes before I need to leave here.
What can you tell the patient? How's that patient doing, the one that we've identified?
So that's part of the good news here is this patient is in their 50s. They were seen at Mayo. They were discharged to home. They're recovering at home now, and they're doing well. It looks like they're going to be fine.
The health department said earlier that this person may have been symptomatic at work. Can you tell us more about where they work? Are they a healthcare provider?
Well, because of confidentiality of the case, I can't comment specifically on where the person works or specific details about the case, but I can tell you that we're actively working at it with the Minnesota Department of Health to ensure that people that are at work or other personal contacts are being notified and are aware of the situation and then self-monitoring themselves for the next 14 days.
I think it was Dr. Fauci at the federal level who said that he thought this was going to get worse before it got better. Is that a message that resonates here in Olmsted County as well?
Well, I think when we're looking at the situation globally now, we can actually see China looks like it's actually almost through a first wave here. We're seeing transmission decrease in that area of the world. I think the United States is in a situation where we're where China was a month or so ago, 2 months ago. And so we're seeing increasing activity. The more that we look, the more that we're finding. And so as we start seeing cases in Minnesota, I think it's likely that we're going to see more. I think it's likely that we're going to see local transmission here at some point. And so I wouldn't say worse before it gets better. I think this is something it's important to keep in mind again, that 80% of people that get this will have a mild clinical syndrome. It's similar to a cold or the flu where you get a runny nose, a little fever, and a cough. So it's not a situation where we really have to be worried about it, but I think it's likely that we're going to see more cases and probably transmission across the nation and here in Olmsted County.
Can you talk more about that travel? You said this patient had been traveling in an area where there were a lot of cases. Can you speak more on that?
Well, I think we're seeing more areas in the country with local transmission, and I think related to that, we're seeing more people who are traveling to places like California and Seattle and New York and other areas where we do see transmission. I don't want to comment specifically on this person because of their privacy about where exactly they traveled, but we are confident that they did travel to an area where there are cases and were likely exposed there, and came back to Rochester incubating the virus and got sick here. This person traveled outside of the United States.
How do you balance sort of the privacy question with the fact that this is very important for public health and you want to get out as much information as possible?
Yeah, that's an age-old issue in the world of public health. I think it's important for us to have details about individuals and about where they are and who they're sharing air with and that sort of thing. But at the same time, we want to respect the privacy of individuals as much as we can and not put them under undue pressure while they're sick and end up with them needing to answer a bunch of questions that they don't want to answer. So we're working with them, but we want to make sure that we give them the privacy that they need to.
Can you talk a little bit about some of the
Been able to get
you
I'm sorry, the people that this person came in contact with, what's your confidence level been able to reach all of them? And is it like if this person went to the mall, is it worth saying, hey, this person went to the mall?
Well, some investigations are tougher than others. I think this particular situation, we've got some things on our side, like the person lives alone, and we don't have some other concerns that we might have where they're out in public areas in big meetings or big congregate settings. For those that are exposed, it's a small, limited number. I think we're pretty confident in this situation that with working with a person that's able to communicate with us, so that we're getting the best information about who may be at risk, and we're able to contact those people and follow up with them.
Can you talk a little bit more broadly about what potentially unique challenges Rochester has in dealing with this? We have a world-class health institution, but that also means we have a lot of people traveling here. We have a lot of people who work in the healthcare profession. That risk of transmission might be higher. I don't know. Can you talk more broadly about that?
Well, I don't want to speak for Mayo, but Mayo is a great facility, and they've already stopped doing elective procedures and things like that for people that are living in areas with active transmission. And so they're doing the best I think they can to decrease the amount of risk that is coming into the community. But like you said, Rochester is an international city. We've got an international airport. We've got people coming and going here all the time. We've got a health community. And so I think our situation mirrors a lot of metropolitan areas around the country, that it's possible, and I would say at this point probably likely, that someone's going to come into this community with this virus and potentially expose other people to it. But that doesn't mean that we're at any higher risk or anything like that. I think every city in the United States is at the same risk that we are right now, and that's why we need to prepare for it.
You said that there was an increase in people wanting to be tested. Can you talk about some of those numbers?
I don't have specific numbers in front of me today, but what I can say is that we're hearing from our clinical providers in the community that they are seeing increasing numbers of residents showing up asking for testing. And so one thing that we need to be working on is not putting a strain on those emergency departments and making sure that people that really need the care get it. At the same time, we are still in a containment phase in Minnesota. What that means is that we're attempting to reach every case that is out there. We're trying to find every contact that's been exposed and stop transmission locally. If we're able to do that, we eliminate the virus from the population. However, as we're seeing around the world and now in the United States, more and more areas in the country are moving to mitigation phases. And at some point, if we were to move to that, the question really becomes about ensuring that the sickest people get care while we encourage others to stay at home and away from crowds, especially if they're symptomatic.
Did the patient, when you say seek attention at the medical centers, I'm assuming, are there any individuals that they came in contact with are being told to self-quarantine, whether that's for 7 or 14 days?
So as far as the presentation to the hospital goes, what we're hearing through Mayo's infection control is that they did everything that they're supposed to do. This patient came in, they knew that this person was coming. All the appropriate precautions were taken to minimize exposure to staff and to the emergency department. And so from what we're seeing here, Mayo did an excellent job of ensuring that the risk to the community is minimized as much as possible.
So no one's under quarantine?
Not associated with the medical visit.
Can you say where specifically Mayo this person was directed to come to?
I believe they showed up, or they ended up coming into the Mayo's emergency department.
And can you describe, if this person lives alone, as you mentioned, what is the county or what sort of assistance are they getting? What does that look like as far as getting food,
Right.
and other things day to day that they
Right, so that's another thing your local health department does. In Minnesota, we're required by state law to ensure that individuals, if we're requiring them to stay home and away from other people, we need to make sure that they've got access to food and medications and things like that. And so in this particular situation, that's something that we're working on with that patient, is to make sure that if they need groceries, if they need food, as long as we're considering them infectious, we need to make sure that that person has everything they need at home. And so that's something that we're actively doing.
So you are actively making those deliveries?
I wouldn't say we're making deliveries. I think we're working with the patient, and that's something we actually do with other at-risk individuals too. If we're going to tell them to stay at home and away from other people, we absolutely need to make sure that they've got everything they need so that they don't need to leave home. And so I know this is evolving pretty rapidly today, and that's something that we've planned for. I'm sure we've got a team that's ready to do that, and I believe at this point they're working with the case and a small group of other people to make sure that that's available to them.
What does check-in look like for the patient?
Collaboration between you and Mayo Clinic. Are you taking the lead on it, or is Mayo Clinic taking the lead as far as putting out warnings or direction to businesses, city members?
I missed the beginning of that because both of you were talking at the same time.
Sorry.
But you want to go first, and
Yes,
then we'll.
what does check-in look like for this patient? I know they're at home, so is there a doctor going to them? Are they taking temperatures, relaying the message? What does that look like?
Well, for someone that we know has an infection, first they're evaluated in this case in a clinical setting, in this case in Mayo. And so this particular person was identified or evaluated, and it was deemed that they're not seriously ill. They're like 80% of people that get this, they've got mild respiratory syndrome. And so the physicians that were evaluating this patient were confident in sending them home. What we tell a person in this situation is let us know if that changes, if you start having difficulty breathing, if you're having trouble standing up and walking around, or you're seeing other major issues going on. They're instructed to call us and to coordinate with with physicians to make sure that we can get them reevaluated and see if there's a need for a higher level of care. So it's for people that are asymptomatic that we want to monitor those people and ensure that they're not developing symptoms. So we do that for 14 days after the exposure. We're working with Minnesota Department of Health to coordinate that and make sure that if people were to develop symptoms, they know what steps to go through to make sure that they don't expose other people, and if necessary, get tested, and beyond that, if they need it, get medical attention. So,
We know that there's so much collaboration going on between all the health experts. Is the county health department, through the state, giving the recommendations of what to do, or is that coming more as a directive from Mayo?
as far as the community goes, I think we're following the state's lead. The state is following the federal lead. However, what we want to do is encourage our local residents to make the best decision they can based on the information that's available, whether that's as a business owner or as a resident of the community or someone that's at higher risk. And so, like right now, we're following the CDC recommendations for people that are in that high risk or higher risk population. Mayo Clinic is one of our partners. We're working very actively with them. Where their recommendations and their expertise really lies is in taking care of people that are sick, making sure that they've got the care that they need, and what we're coordinating with them is making sure that our community is safe. And so there's a distinction between our areas of expertise that I'm happy to be working with Mayo on. I think there's a good relationship there.
Are there any plans whatsoever to have subdivisions of anywhere for quarantine like they have done out in New York?
Well, I think we're taking the situation as it comes to us. We don't have any plans now with as far as quarantining neighborhoods or anything like that. As of right now, knowing that there's no evidence of local transmission. However, we are looking for it. But as long as we don't see evidence of local transmission, there's no reason to be thinking about having to isolate specific areas or anything like that.
Aside from the patients that we're talking about here today, have you told other people to self-quarantine, even though there's, no idea if they've, if they've been in contact with that person, or, is there anyone else that you've told to self-quarantine?
Well, I think we're working with MDH on identifying individuals that may be coming back from areas where there's active transmission or risk, and those people are being told to isolate themselves at home if possible. And so that's something that, as people are coming and going, we're pretty actively working with the Minnesota Department of Health on identifying those and making sure that not only are they being monitored, but we're making sure that they're staying away from congregate settings as well.
We have time for just one more question.
Do you have an estimate of about how many people you guys reached out to individually who had contact with this person?
It's a small number. I don't have an exact number, but so I don't want to say a specific number. But what I'm being told from our investigational staff, both we're actually in coordination with MDH on this, is that it's a small number of contacts that we're following up with.
And I think I'm going to cut you off, but if we have questions for our partners, they are also available. So you can go to your next one.
Thanks, everybody, for coming. Yeah, sure. My name is Graham Briggs. It's GRAHAMBRIGGS, and I'm the Director of Public Health for Olmsted County. Thank you.
Martin, would you like to say something or any questions for?
Well, on behalf of the city, we are working with our partners, Olmsted County Public Health, as well as, we are working with our partner at Olmsted County Public Health, as well as the State Department, and we've also had contact with the Federal Department of Health and Human Services Region 5 Coordinator. So everybody is communicating well, as I think the community would hope. The city as a team has been meeting and will continue to meet, and we'll keep the community abreast of any decisions that are made, and certainly we're looking out for our employees as well. But I think what's important here is the message you've been heard. Our office phones have been ringing all morning and actually all week, and people are looking for direction. And I think the message that you heard is that businesses and individuals need to make the decisions for themselves based on their own health, based on their own beliefs, and so I think that's, until we hear something more from our either federal, state, or Olmsted County partners, we're going to just continue to work and monitor the situation and rely on their guidance.
Superintendent Munoz, I have a question for you. With universities around the world transitioning to online classes, what is happening in Olmsted County for schools here?
Well, I can only speak for our district, and I'm glad you asked that question because our phone's been ringing off the hook. We are, at this time, do not have plans to close a school or close the district. We continue to work with our partners. Just let me explain how our day was today. We had some of our staff meet with our partners this morning. We did a webinar with the Minnesota Public Health and the Minnesota Department of Education. We had an hour meeting after that, and we're scheduled to have another hour meeting after this press conference. So we are having conversations about what if we would have to close a school or have to close the district down, what would we do? Friday, we plan on working with our teachers to get some ideas on how could we provide or facilitate the learning if we would have to shut down the district. So we plan to have conversations with teachers this Friday. Our food service is having conversation about could we still provide breakfast and lunch somehow during that time that we're closing down. So we are having those types of conversations, planning for the worst case scenario. But at this time, we do not see any changes in how the district's going to be running.
Do you see any possibility to cut down on extracurricular activities or, socializing events at any of the schools, high schools, anything like that?
Yes, we did have that conversation today. We didn't land on anything after hearing Graham speak. At this time, I think we probably will not go to that point, but there may be a point where we may limit our students' access to going to conferences or events, but at this time we plan to carry on as normal. But really working on educating our staff and our students on, proper hand washing, trying to keep a good distance between people, and really working to educate our students so they can protect themselves. All right, thank you.
Thank you all for coming.